Non-loop method case with supine position and pressure on the upper pubic bone at turning point. Having inserted into the anorectum, angulate the tip upward. The rectal folds can be removed by turn maneuver. The strong bend toward the bottom of the screen is the end of the rectum. Angulate the tip down to touch the mucosa, then rotate the shaft clockwise idly. Slightly adjust the folds to 12 o'clock and flip it up with up angulation. RS is deployed to the left side, so the scope is advanced with left angulation and left turn. Angulate to the upward. At the beginning of sigmoid colon, the lumen expands to the right. The first thing to do here is to deflate. Advance the scope a little further. The bend appears at 12 o'clock. Apply up angulation and pull the scope. Then, a strong bend appears at 2 o'clock. This is key point, since it doesn't rotate clockwise easily. Apply right torque at the position where the scope tip is pushed back a little with up plus left angulation. When the bend has been clockwise rotated, the up angulation will be released. Then the lumen expands toward the bottom of the screen so that it can be crossed with down angulation. The next bend will appear at 11 o'clock, so apply left torque by twisting the scope to the left and pulling back with up plus left angulation. Then the bend will rotate counterclockwise. The next rightward bend will also cross with down angulation after applying right torque to rotate the bend clockwise. Next, apply up angulation and torque to the left. The bend rotates counterclockwise. The rightward bend is crossed by down plus right angulation. Here, apply up angulation and left angulation. Next, torque lightly to the right and cross with down angulation when the bend comes toward the bottom of the screen. Next, the bend is again in the upper left direction, so torque to the left with up angulation. In the next lumen, deflate because of air trapped in the lumen. Here seems to be turning point. Here is where the scope stops reaching the next bend. Change to supine position. In the supine position, the scope tip may be able to reach the bend, but in this case, simply placing the patient in the supine position did not seem to change the situation. Try applying pressure to the upper pubic bone. When the bend is approached by pressure, the scope tip reaches the bend, hooks onto the bend with up angulation and applies left torque. The bend rotates counterclockwise. Down angulation. Right turn. Deflate. The lumen will expand downward to the right. The yellow residual fluid increases, confirming that it has entered D. Release the pressure. Once in D, advance the scope along the lumen, and the next strong bend at 12 o'clock is the LCF. Drop the scope tip on the top of D. Make sure there is no deflection of the scope and release the extracorporeal loop.